Chapter 8, lifting and moving patients. Introduction. As an EMT, you'll be called upon to move patient at various stages. Several times you will be called upon to move patients. You will have to move patient from the scene to your stretcher, from the stretcher to your ambulance. You load the patient in. You have to remove the patient when you reach the receiving facility. You have to take the patient in and transfer the patient to the hospital bed or examination table. So you'll be called upon to do a lot of lifting and moving. And it's very important to recognize that your safety as your partner and patient is very important. So you have to ensure that you take the necessary precautions and proper technique in order to avoid self-injury and causing injury to your partner and also the patient. So very important to know proper body mechanics and proper power grip and power lift. So it's always easier and better to roll a person along than instead of lifting the person. So very important, our device that we mainly will be used for rolling the patient is our wheeled ambulance stretcher, and some call it gurney, some call it cut, different names, but it's our wheeled ambulance stretcher. It's the main device will be used to roll the patient so it can avoid the lifting and moving over a longer period. So you will still have to lift the patient to the stretcher, but to move from the location to your ambulance, it's easier to roll the patient on the stretcher than having to carry that patient all the way to the stretcher. So it's a very important equipment that you must know different types of wheel ambulance stretcher. You must know the different components of it. You must know how it operates, and you must check it and ensure that it's in good working order. Very important that you know every equipment on the ambulance, how it functions, so that when the time comes, you will know exactly what to do. So if you go on a unit, there's a new equipment there, ensure that you know how it operates before the time comes. It shouldn't be that when you're ready to use a stretcher, that's when you're trying to find out how it works and you realize that you didn't know how exactly it works. That's not good for patient care. At the end of the day, you have to do what's best for your patient. So it's a very commonly used device. It's one of the most used device on the unit. It's coming to play all the time. The wheel ambulance stretcher, it weighs approximately 40 to 145 pounds. And so you have to recognize that we normally don't lift this stretcher if you're going upstairs. It's easier to get a stair chair and move the patient because you have to add the weight of the stretcher to the patient's weight if you're going to use that stretcher to move the patient down or upstairs. So generally not taking up or downstairs or where the patient must be carried for any significant distance. So use your stair chair where you have to move the patient from different landing or your backboard. The wheel ambulance stretcher, moving a patient by rolling, used in a stretcher or other wheel device is preferred when the situation allows and helps prevent injuries from carrying. So at all times, we are going to try the best way possible to avoid less pressure on ourselves as healthcare provider but at the same time, you're gonna do what is best for your patient. So you're not gonna, because you don't want to lift, you're gonna compromise your patient either, but you're gonna use the best method possible to balance that equation. So before going on a call, familiarize yourself with the specific features of the stretcher your ambulance carries. You must know how your equipment function before it is needed for use. And we are going to look further on team dynamics. You must know how you and your partner work together as a team to operate the equipment, because a wheel ambulance stretcher is a two-person operation. One person cannot operate the stretcher or should not operate the stretcher once a patient is involved. By itself you can, but once a patient is on it, must be a two-person operation at least. We have newer types stretcher which are motorized. To an extent, you use one person. With the non-motorized ambulance stretcher, it's definitely gonna be a person operation. So the general features, all ambulance stretcher must have these features. It must have a head and a foot end, and you must know the difference. You must, which end is the head, which end is the foot. You can't be putting a patient on the stretcher, and when you look, the patient is